Sikuwa najua niko na mimba, nilikuwa tu na kama mgonjwa nini. Sikuwa nashughulika kwenda hosi.
Nilienda clinic kama niko na 4 months. Kwanza labda nikae miezi ikikaribia, nitaenda nyumbani Western, nisalie huko.
In the heart of Nairobi City, Kenya, lie the vibrant yet challenging sub-counties of Makadara and Kamukunji. Here, the struggle for maternal, neonatal and child health services continues, despite significant global and national progress. Globally, significant strides have been made to reduce maternal and child mortality. From 1990 to 2022, neonatal deaths decreased from 5 million to 2.3 million. Yet 6,500 newborns still die daily, accounting for 47% of all under 5 child deaths. Maternal mortality has also seen improvements, dropping by 34% from 339 deaths per 100,000 live births in 2000 to 223 in 2020. However, postpartum hemorrhage, hypertensive disorders and complications from unsafe abortions remain leading causes of death. The Sustainable Development Goals aim to further these improvements. SDG 3.1 targets reducing global maternal mortality to below 70 per 100,000 live births by 2030, while SDG 3.2 focuses on ending preventable under 5 deaths. In Kenya, while progress has been made, the rates of maternal and child mortality remain alarmingly high. According to the 2022 Kenya Demographic and Health Survey, the under 5 mortality rate stands at 41 deaths per 1,000 live births, while maternal mortality at 355 per 100,000 live births. This is far from the SDG targets. To address these challenges, Save the Children Kenya, in partnership with CFK Africa and the Sub-County Health Management Team, is implementing a maternal, newborn and child health MNCH program in the underserved urban areas of Makadara and Kamukunji.
Looking at the data from these 2 sub-counties, Save the Children saw that there's a high burden of maternal and newborn child health within these 2 sub-counties. So with these poor indicators on MNCH, the organization saw it fit that we can be able to come and contribute to the quality of care in these 2 sub-counties. Additionally, there was low level of knowledge and skill gap that was noticed between these 2 sub-counties. The public health facilities within the 2 sub-counties were ill-equipped to offer MNCH services. The next one is because there's low coverage of treatment of common childhood illnesses, poor referral mechanism, as well as silo programming.
When they came on board, actually we were able to train with them 100 community health promoters in Kamukunji, where we are implementing the program. By having them trained on MNH model, they're able to give the services very well.
The overall goal of it is to be able to contribute to the reduction of preventable and maternal newborn deaths within Kenya.
At the community level, over the past months, community health practitioners have been reaching households with critical health education and referrals. Through regular community dialogue days, the communities are now more informed, engaged, and involved in shaping the quality of health services.
Wakati tunapotaka kujua wajawazito wako wapi, ni ile visit ya kila month. Lazima tutembelee hawa, to revisit hizi household. Na wakati unapotembelea hizo household, utakutana na hawa mama ambao wako na ujauzito kwa hizo household na watoto wa under 5.
Nasisitizanga kwa mama ni hali ya kufuata clinics. Immediately mama akijua ameshika mimba, pale tu mwanzo immediately anakuja kuattend clinic ya antenatal.
Mama kufuatilia kliniki akiwa na mimba, apate zile chanjo zinahitajika akiwa na mimba, kukuja azae, anakuja huyo mtoto immediately anapatiwa kama hii BCG na oral polio ya kwanza, inakuja na unamfuatilia kwenda hizi clinics zile zinafuata, kwenda hata pale within 14 hours, naenda na muonyesha jinsi ambavyo anaweza nyonyesha, na hata pia kama hana mtu huwa anajitolea mpaka hospitalini kwenda kumwangalia kila siku na kumsaidia kunyonyesha.
The use of data collection methods has created space for community voices to be heard, promoting local ownership and accountability across the health system.
Kitambo tulikuwa tunaandika kwa makaratasi ama kwa vitabu, kukatokea ndani ya hiyo bag pia kulikuwa na simu ambayo imebeba data yangu yote. Watu 126 wako hapo.
That has helped us improve our data because this data eventually we use it for decision making.
At the facility level, the program is driving improvements in service quality and infrastructure. Healthcare workers have been trained on the revised guidelines using the ThinkMD digital tool to enhance clinical decision making for childhood illnesses.
We've trained on emergency, maternal obstetric neonatal care, which gives the healthcare workers the skills to manage emergency situations that occur in the labor ward. We've trained on maternal perinatal death surveillance and response, where we equip the healthcare workers with the skills to be accountable for any maternal or perinatal death that occurs within the facility and how to do the audits. We've also trained the healthcare workers on MNCH, which is Integrated Management of Childhood Illnesses, basically to give them skills on how to manage the basic childhood illnesses like pneumonia, diarrhea, malnutrition and malaria. And also we've been able to be provided with a ThinkMD, a system where they're able to assist the healthcare workers to easily diagnose and manage the conditions.
Most of the facilities, especially the publics, none of them had a Kangaroo Mother Care space. When a child is born either with low birth weight or a preterm, they were forced to refer them outside the sub-counties or other private facilities. From there, we did a facility health assessment, identify the gaps that were in these 4 health facilities, and now that is what made us to be able to do the renovation for these 4 KMC spaces. With the renovation in these health facilities, we empower now the healthcare providers to offer comprehensive care to the low birth weight and the preterm, so that between delivery, before they are discharged, they are able to receive given education on the importance of KMC, Kangaroo Mother Care, the importance of good feeding, which is also exclusive breastfeeding. By the time the child or the baby is discharged, there's the continuum linkage to the community to continue KMC at home with the mother and also their caregivers having knowledge on the benefits of KMC.
When we go to the community, we are able to see the impact at the household level because we are having more women now doing exclusive breastfeeding. Our data for immunization has gone up, especially among the households where the community health promoters were trained. So it is reflecting in service uptake, it is reflecting in improved nutrition, and it is reflecting in more awareness at the community level for our mothers.
Nilikuwa na kunitembelea muda kwa muda na kunivia devices mpaka nikafika kiwango cha kwenda kujifungua. After kujifungua, mtoto akawa underweight, hakuniacha. Alikuwa anajikaza tu kuja kuona vile anaendelea, ananivia mawaidha. Sasa mtoto analea na kuimprove, si kama vile alikuwa kama kitambo. Sasa anaweza akazimama na vitu.
CHP wananitembelea, nimeona tofauti. Wananikaidi ukule hivi, ukaa hivi.
Additional capacity building efforts in respectful maternity care, emergency obstetric care, and infection prevention are equipping providers to deliver high-quality care with compassion and confidence. The next phase will prioritize proper use of the Kangaroo Mother Care rooms, mentorship, supportive supervision, and expanding referral systems.
CFK Africa being a local organization, we have factored in ways to ensure that these things remain within the community. So what we have done within the community is closely working with these CHPs to ensure they transfer the same knowledge to other CHPs. And we have created a care group where a CHP has members from that community that he or she train, and the same members pass the same information to other members. So when it comes to facility issues related to data, we've created a model whereby even if we are not there, the sub-county health management team and the facility, they are able to do those activities without us being there and with the minimal resources that they have. As working with Save the Children, we are also working closely with the advocacy team to ensure that all these activities that we are doing are incorporated to the sub-county and the county budget. So that is still a work in progress, and we hope it will work well.
We have strengthened in terms of referral system at the community level, in terms of empowering community, in terms of also doing what's called community outreach at the community level, and that now brings quality of care closer to home in terms of immunization, family planning, MNCH services. Now that's one aspect. The other aspect that also have been strengthened is referral from community to the facility. Once now the patient receive at the facility, are they also getting the quality services that exist in terms of skill delivery, ANC, personnel, and availability of drugs.
Community engagement is a very core component when it comes to programs, because community engagement involves the community. And when the engagement is there, the community completely owns the project. So they know this is what the project wants, and this is what we are going to gain from the project. So through the engagement, the community is able to completely support the project and ensure the project achieve its goal and the project remain within the community. So that is where sustainability is. Through capacity strengthening sessions supported by Save the Children, CFK Africa has been able to develop child protection and safeguarding policy. Aside from that, we've learned some activities that were not in our facilities before. So through the training that we conducted in other sub-counties supported by this project, CFK has also been able to bring those trainings home. One of the training is the EMOC. We've been able to train our own healthcare workers within CFK on EMOC.
From March 2024 to September 2025, the project achieved remarkable results. 84,091 cases assessed for common illnesses, leading to 2,956 cases treated. 309 healthcare workers and 212 community health promoters trained in MNCH. 1,299 preterm and low birth weight neonates initiated on Kangaroo Mother Care. 28,709 mothers received skilled birth attendance.
Nikigundua niko na mimba, aliniambia nini, alinirifaa kwa hosi nafaa kwenda. Nikaenda huko nikaanza kliniki yangu, na akakuwa ananifuatilia na vitu mingi sikuwa najua about kwa na mimba, akakuwa ananielezea, anifunza vitu nafaa kufanya, vitu sifai kufanya. Hivyo hadi wakati nilijifungua nikaenda hosi, enda alikuwa na mimi, akakaa na mimi hadi kutoka hosi. Hadi kuposition mtoto kunyonya nikuwa hosi, alinifunza. Naogopa hadi kumosha juu ya kitovu, lakini akanionyesha venye unamosha na mpanguza kitovu, mtoto anaotajua kidogo, namrudisha kwa nyumba. So napata vitu mingi sikuwa najua. Tena akaniambia kama mtoto anafaa kunyonya miezi 6, mimi sikuwa najua.
The journey towards ensuring access and utilization of MNCH services in Makadara and Kamukunji is ongoing. Through dedicated efforts, we can continue to reduce preventable maternal, newborn and child deaths, paving the way for a healthier future for all.